Hello guys, my name is John Michael Sosa, and for this assignment on the synovial joints, I will be doing the glenohumeral joint, also known as the shoulder joint, and is located right here in between the humerus and the scapula. As you can see here on the diagram that I provided to you, that I found on Google Images and filled out on the Word document and then screenshot it and pasted it onto the PowerPoint. You can see the green part highlighted, which is the glenohumeral joint, also known as the shoulder joint. Right here, you see the scapula to the right and the humerus to the left going down to the body. So what you're seeing here is an articulation between the scapula and the humerus. The glenohumeral joint is a ball and socket type synovial joint and is one of the most mobile joints in the human body. Okay, so moving on, there are two articulating surfaces on the glenohumeral joint, and these is going to be the spherical head of the humerus and the concave glenoid fossa of the scapula. Being a synovial joint, both articular surfaces are covered with hyaline cartilage. Moreover, the glenoid fossa is also a shallow paired pit on the superlateral angle of the scapula. Moreover, the ball and socket design of the shoulder joint allows for a wide range of movements in multiple planes, which allows for flexion, extension, abduction, adduction, internal rotation, external rotation, and circumduction. The shoulder joint also relies on the surrounding ligaments, the tendons, and the muscles for stability. It also uses the synovial joint, which the synovial fluid, which helps whenever there's a lot of friction going on, the synovial fluid helps relieve that friction and provides a more less pain and just provides a protection between the spaces between the two bones. So there are three glenohumeral ligaments located on the anterior side of the joint. The three major ones are the superior, middle, and inferior. They function to stabilize the front part of the shoulder joint. The coracohumeral ligament is located from the coracoid process of the scapula to the greater tubercle of the humerus. This functions as a way to help maintain the position of the head of the humerus within the glenoid cavity. Moreover, the transverse humeral ligament is located within the rotator cuff. This functions as a protective role by holding the long head of the bicep tendon in place within the bicipital groove. This in turn helps prevent friction and irritation of the tendon during arm movements, which contributes to joint stability. Ligament stabilizes the glenohumeral joint by preventing excessive motion, maintaining alignment, and supporting dynamic stabilization. So some unique features on the glenohumeral joint are the burses, which are small fluid-filled sacs like balloons that act as cushions or structures that lubricates the areas in between the tendons, the ligaments, and the bones in order to reduce friction, allowing for smooth movement across the structures. The synovial fluid is also a clear, viscous fluid that fills the synovial cavity of the shoulder joint. This functions as a way to lubricate and nourish the joint's articular cartilage, reducing friction between the articulating surfaces. Naming the shoulder joint a ball and socket joint makes sense due to anatomical structures of the humerus, which is shaped like a ball, and the glenoid cavity, which is shaped as a socket. The head of the humerus is shaped around, again, like a ball, while the glenoid cavity is a shallow concave structure that functions as a socket. So the humerus just fits in perfectly into the dip or into the cavity of which is the socket of the glenoid cavity. So the movements that are allowed by this synovial joint, which is the glenohumeral joint, is flexion and extension in the sagittal plane, abduction and adduction in the transverse plane, and circumduction and horizontal abduction and horizontal adduction. For the last slideshow of the presentation, I will be performing the movements along with the planes that are associated with them. So for the shoulder joint, flexion and extension. So flexion will be this, bringing the arm forward, and then extension will be just bringing the arm backwards. As so, this will be the sagittal occurring on the sagittal plane. Now for shoulder abduction, adduction, abduction will be doing this, so doing like shoulder raises, and then adduction will be bringing it back towards normal and anatomical position. So this occurs in the transverse plane. Finally, circumduction. Circumduction is when you just move your shoulder in circles as so. This people often do this as a as exercise or as a just to warm up the shoulder joints before doing an exercise. The last two are going to be horizontal abduction and horizontal adduction. So this horizontal abduction will be doing this, and then horizontal adduction will be bringing it back as so.